Hi, I'm Dr. Tirgari, here to go through your patient packet with you and hopefully bring some clarity to the packet that you will be sent. The purpose of this is to answer some of the questions that you may have when you read the packet. Anytime a procedure is being done, even if you're just getting Botox, there's really only two things we want to make sure that we minimize. The first is going to be bruising, which is obvious since we're going through skin. And the second one is going to be infection, which is also obvious since we have bacteria that live on our skin at all times. For the sake of bruising, we like to give our patients vitamin K. You'll have a start date on this envelope that we send to you. And by taking this, we found that bruising can be minimized even up to half. This makes your recovery much shorter and smoother. You will also get an antibiotic from us. And depending on your allergies, we will choose which antibiotic you will be taking. You'll start the antibiotic the day before, and you'll take it for about a week until it's finished. With this approach, we found that we've experienced almost zero infections. Let's move on to the instruction sheet. The first page is going to be titled Important Information about Tumescent Liposuction. This is an overview of what tumescent liposuction is, who it's for, what it does, and sometimes it may be a little extra information, but we find that it's helpful to give our clients as much information as possible. The second page is what to expect on the day of. We find that this reduces anxiety quite a bit since patients know what to expect when they arrive. From the moment you arrive to all the pre-op that we do, including your blood pressure, your pulse, and so on, to the infiltration of the anesthetic, to the liposuction, and then to making sure you're discharged to somebody that's well known to you. Unfortunately, we can't allow taxis, Ubers, and Lyfts, and the purpose for this is because we want to make sure that an adult who is known to you will make sure you get into your house and onto your couch where you can rest comfortably for the rest of the evening. The third page is your before lipo instructions. Much of this may seem common sense. For example, we recommend that you avoid any medications that increase the risk of bruising. This can include aspirin, Motrin, and other NSAIDs. We also advise you to avoid alcohol since many people do not know that alcohol can inhibit your platelets and increase your risk of bruising. You will want to stop alcoholic drinks for a few days up until the day of your procedure. Of course, we reiterate that you do not want to drive home. You want to make sure that you have a driver ready. If you do not have a driver, we do have transport services available for additional cost. And that's entirely a choice that's up to you. We want to make sure that you have something in your stomach before your procedure, since sometimes your procedure may be later in the morning or in the afternoon. We recommend foods that are light and not greasy or heavy. We find that foods such as toast or juice are greatly improving your chance of avoiding nausea or vomiting due to the anesthetic. It's okay to have this about 1 to 2 hours before you come in. We also recommend that you wear loose clothing. This is because you will be provided a compression garment after your procedure. Clothes such as sweatpants are going to be very easy to put on after your procedure is done and when you're wearing the compression garment. The rest of this is going to be self-explanatory, and it recommends that you avoid things like moisturizer that can get in the way of the adhesive pads that we use to monitor your pulse and blood pressure. Your final page is going to be the after lipo instructions. We like to give this to you in advance of your procedure to make sure that you have plenty of time to ask us any questions in advance. Of course, you do not want to drive home. And we want to make sure for the first 24 hours, you stick to a light diet, nothing heavy or greasy that can increase your risk of nausea. On day 1 of your procedure, you'll want to rest and avoid any strenuous activity, avoid signing any documents. You'll just want to rest and take it easy. Don't do anything that's going to potentially perturb you. The next day when you wake up is when you're going to take your first shower. You'll take off your compression garments. You may notice that some of your absorbent pads may be soaked with anesthetic, which is great. It just means you're draining. You'll take a shower. You'll wash with soap and water. You'll pad the areas dry, and then you're going to go ahead and put absorbent pads on there again to soak up any drainage. It is crucially important that you do not block those incisions and you allow them to drain. We leave them open so that any residual anesthetic has plenty of time to drain out and exit your system. You'll have plenty of pads from us to replace any drainage, and these will be included in your kit. After you take your first shower, you replace the absorbent pads, put your compression garment back on, and we recommend some light activity, light walking, nothing too strenuous. After the third day onwards, it's crucial that you do not do anything that's going to impede your healing. This is so that your incisions can heal without any risk of scarring and that they can be completely unnoticeable. We find that agents such as peroxide can sometimes diminish your healing. We want to make sure you avoid these. Soap and water is more than enough to clean your wound. We also want you to avoid anything that can increase your risk of infection. This means avoiding saunas, jacuzzis, hot tubs, or anything else. And you're welcome to call us and ask us if you have any questions about any activities. Some of these are going to be included very clearly in your instruction packet. For folks getting abdominal liposuction, we've put one of the most important recommendations in big bold letters here on this page. And this is to avoid any elastic garments over your liposuction area. This includes tight underwear, elastic bands, or wearing your jeans or your pants too tight. We recommend wearing your pants low on your hips or avoiding them altogether. For women, sometimes skirts or sundresses are an excellent alternative. The reason we want to avoid elastic is because we want to minimize the risk of any indentations that could impair your results. The next paragraph are some of the most common side effects that we want our clients to expect. These are always going to be temporary. You can expect these to resolve on their own. For example, itching is sometimes noted and it goes away. Numbness is very common after liposuction and it also goes away. Sometimes clients who have had abdominal lipo, for example, will have some temporary swelling in the groin, and this will also resolve on its own. At the very bottom of your form, you'll have our office number. You'll also have my cell phone number. You can call and text for after-hours emergencies, and you have our email. So if you have any questions, you can reach out to me or my staff to answer those questions. We hope this video was informative to you. As always, if you have any other questions, feel free to reach out to us. We welcome hearing from you. Thank you.